There are a lot of myths surrounding fertility, and so today we would like to address what is fact and what is fiction in the field of infertility. That is true. That is true. When a little girl is born, she has about 1 million eggs, and already by the time of puberty, it's down to about 500,000, 300,000 to 500,000. And then not only through ovulation eggs are lost, but eggs actually sort of die off all the time, go away all the time. And so fertility declines over time in a quantitative and qualitative way. So the number and the quality of eggs diminishes, and fertility is usually still pretty good until the mid-30s, and then at age 37, 38, it starts to decline faster and faster. That is fiction. The sperm can actually survive inside of the female body for about 3 to 4 days. Now, it's true that the egg is only available for 24 hours, but the chance of getting pregnant is over a span of several days. That is true. If somebody is on birth control for several years, that has no impact on future fertility, and normal menstrual cycles return pretty quickly after stopping the pill. Now, that is as false as it gets, because at least 30 to 40% of the time we find a problem in the male fertility. And so sometimes there are issues that we uncover on both sides. So it's very important to have the male fertility aspect checked out very quickly at the beginning of the infertility evaluation and do a screening semen analysis. That is false. Now, while IVF is the most effective treatment we have for a lot of infertility reasons, it is not the only treatment we have. And often we try a stepwise approach where we start with something that is less invasive and less complex and less expensive. And then maybe if those less invasive and less expensive treatments don't work, then we have IVF as the most effective treatment. This is one of the most unhelpful things that somebody can say to another person that's struggling with infertility. Now, and while it is potentially true that stress may contribute to the experience of infertility and may add an extra layer of difficulty in the journey that's already hard, it is not true that if you just relax, you may just get pregnant like that, because oftentimes there are actual issues that need to be addressed, and that might be more like something that an infertility specialist should advise you on, rather than your friend who's trying to be helpful but then says you just need to relax, and that actually hurts more than it helps. We hope that debunking some of these fertility myths can help you with your family building journey.